Hey everyone, thanks for joining today. This is Xtium's webinar, Is Your Health Center Ready for the Cloud? I'm going to go ahead and get started with today's agenda. Today we'll be giving you an overview of the cloud. We'll explore cloud motivations and benefits specifically for federally qualified health centers. We'll dispel some common myths and misconceptions that we hear out in the market. We'll give you some tips for selling your executive team and getting buy-in from them. We'll also give an overview of a typical or successful cloud migration. We'll hear from Ampla Health about their experience with cloud services. And then finally, we'll wrap up with some Q&A. So if you have any questions, definitely throughout the webinar, feel free to submit them, and we'll take some questions at the end. And at the end, I'll also tell you some more about the free health check that you're eligible because of attending today's webinar. And we should wrap up around 12:45. Today's presenters are Eric Rios, Barinder Suprai, and James Crandall. Eric is Vice President of Client Services and Healthcare Practice at Xtium, a leading managed cloud hosting and disaster recovery service provider. He has over 16 years of technical leadership and operations experience at healthcare organizations. And prior to Xtium, he was the CIO at Greater Philadelphia Health Action, which is one of the largest FQHCs in the country. Barinder Suprai is the IT Director at Ampla Health, a network of health centers in California. He has over 15 years of IT experience, having previously worked for NEC Corps of America. He was in a systems engineering role, providing sales support for hardware and software solutions. And James Crandall is systems administrator at Ampla Health. He has been in the healthcare tech field for the last 14 years, and he has been working with nonprofit organizations for the last 21 years. And with that, I'll turn it over to Eric.
Thanks, Jen. And as well as the attendees, I really thank you for your time today. I know your time is valuable. We want to make this very meaningful for you to really understand not only is your health center ready for the cloud, but just in general about the cloud and a lot of the benefits, and really dispel a lot of the myths that are out there. So before we get started with the actual slides, we want to just put a poll out there for you. Just so, real quick, couple seconds, if you can answer the poll question, and see what our response is. So with that question, what type of outage are you most concerned about? So if you select one of the following, just take a few seconds to select it. Natural disasters, unreliable infrastructure, human error, and physical breach of the facility. I'll give you a few seconds to do that. Okay. So if we look at the results, most people answered the unreliable infrastructure, and we'll go into some of those details in regards to some of the hardware failure. A couple of you have also selected natural disaster, and probably some of you in certain locations where you probably need to worry about that more than others, but that's good. It's a good start. So in the first slide, just as a nutshell, just to really get an understanding of what type of cloud technology is out there. And just these three, just really basic from an understanding of what they are. So infrastructure as a service, we all know about the Amazon, the AWS clouds of the world, the Googles, the Microsoft, the Azures, where you can take your hardware out of your local data center, move it to another data center, and then you particularly would manage it. Not from a standpoint from a managed service provider like Xtium would manage for you, but you would do that as your own if you made that selection as yourself. Platform as a service, where I don't see much going on within the FQHC market when I worked in the health centers, as well as when I worked in a lot of the community hospitals in my career. This is more geared towards, you have developers who do some sort of website development and or database development that really need to put out 1 to 5 servers out in the cloud so they can specifically work on that. But again, like I said, I don't see that much in this market, but it's just more of an understanding. But then software as a service, where if you haven't implemented an EHR yet or in the process of, there are a lot of vendors who will just say, we'll just give you your EHR through the internet, and you go out there to, you get on the web browser, connect via your credentials, and then you'd access your EHR that way. So that's a sample of what the software as a service is. So a lot of people, when they think about going to the cloud, what's my motivation? What's my benefit? And right from the beginning, we talk about the EHR. Data needs to be ultra secure and accessible. We all know the famous word HIPAA. Basically, security, privacy of your PHI. Again, this is the life that we live in the healthcare world. The whole concept of being able to get to your data, accessible to your data, always to get to your data. Is my data being encrypted? Is the data where it sits, encrypted so that, the chance of any sort of breach, I would be protected. So that's one of the biggest motivational items that people are selecting to go out to the cloud. Another one is, office move to a new location. The days of bringing up a new office and creating a server closet, for what you will, hardware, you need to worry about heating, cooling, network, everything you name it, those days are long gone when you move to the cloud. It's just a matter of, setting up a network connection, and we're in. So it's that much easier from a motivational standpoint to move to the cloud. End of life servers. I met a gentleman 2 years ago when I was on a CIO summit panel. I was the customer at the time, and Xtium was my vendor. And one of the CIOs that I met said every 3 years he's doing a hardware refresh and spending $1 million every 3 years. He worked at a hospital, and I tended to ask him, why would you want to go through those dollars in procurement of those hardware when you don't really have to? So that's another big motivation to move to the cloud. And then basically, need to eliminate mundane IT tasks. We are in the points of, we have to worry about our data. We need to worry about, our day-to-day applications and what it is that we're going to do with that. The fact that, to have to worry about my hardware, that I have to worry about backups. Did backups occur last night? The things that everyday IT people need to worry about all goes away when you move to the cloud. Here's a big one. So, and continue with the cloud motivation. So, disaster recovery. When I was the CIO with the FQHC in the city of Philadelphia, we were with a managed service provider who didn't provide me any DR, and I thought to myself, if we're moving to the electronic health world, I have to be able to have my data in case something were to happen. A lot of you answered, infrastructure or hardware issues, potential of being a little nervous about this happening. Well, guess what? The potential of that happening is pretty likely, and be able to get to that data from a DR standpoint is very, very important. So that was one of the major factors when I moved to Xtium as a customer. I started out the DR, and that's what I really needed, so I can always be assured that I can get to my data. Business agility, collaboration, integration. We talk about health information exchange. We talk about a lot of applications that are integrating with one another. To be able to have data repository, to be able to take that data, that patient data, and be able to treat my patient with the correct information, because I'm able to integrate those applications with others to get the right information that I need. Flexibility, so the increase, decrease use of cloud services according to demand on how much we want to spend. When you're in the cloud, you can make an easy, simple phone call to your vendor. To us, for example, at Xtium. Hey, I need to get a server. I need a server real quick with these requirements, and next minutes later, you got a new server. If you have that internal, if you have the hardware internal, you may have to procure something. You may need to add storage. That storage that may have potential PHI may need to be encrypted. Now you need to worry about that software encryption. So there's a lot of flexibility in the cloud environment. Big data, and I'm going to mention this later again through these slides, that the data that we get from an FQHC, and we all know this very, very well. So I need to have this data so that I can not only properly treat the patient, but I need this data for meaningful use. I need this data for pay for performance. any sort of incentives that a lot of the FQHCs can get today, I can get this data and I can get it anytime I need to get it. So a huge, huge motivational and financial benefit to a lot of FQHCs today. And then speed, get services up and running within a matter of hours, maybe sometimes minutes, depending on the need, depending on the requirement, you can, again, like I stated before, if you need to get a new server, I can get it. Or if I need to move things around, I can do it. It's all about speed. It's all about being flexible. And that was probably, again, one of the major reasons why I selected Xtium when I was the CIO, because of those features itself. So an interesting one here, in talking about dispelling myths and misconceptions. Last year and the year before I joined Xtium, I was asked to sit on some CIO Summit panels to talk about these type of myths and misconceptions. And I sat in a room with 150 CIOs across the East Coast, and the majority came back was about, myth number one, the cloud raises major concerns of security and privacy. But if you really look, and if you take some time out, just go on the internet and just do a real quick search on some breaches, you'll find out the majority percentage of those breaches occur when servers are on premise. When you're out in the cloud, we have the process, the controls in place. We have the right encryption in place. We have all the necessary security rules in place from a security network and firewall. In the cloud, that's where you get a lot of your benefits from, versus having an on-premise data center where someone literally can go in your closet, pick up a server and walk away with it, or unplug something, or do something that you're not necessarily ready for. Myth two, so partnering with a cloud provider means I lose control over my sense of data. That is totally incorrect. Your data is your data. If you need to get to it, you need something, you actually are, you hold the keys to your kingdom. This is your data, so you can tell this person needs access or take away that access. So you're the one in control at all times. Myth three, in order to move to the cloud, I'll have to rip and replace my existing hardware investments. No, absolutely not. The fact is, when you move to the cloud, some people think, well, hey, I need to move my whole entire environment on day one. Well, not necessarily. Some people do it in phases. I want to be able to, let me just spin up my EHR application and put that in the cloud. Let's have that go for a while. And then maybe phase two, 3 months later, I'll move the rest of my environment. It's all about flexibility. And at Xtium here, that's a big key for us, that we're flexible like that, and we can do whatever makes sense for you as the customer. And number four, I'll be paying more for the cloud versus maintaining on-prem. Again, here we go. So as we know, with technology changes, so does cost. A lot of times cost, for example, storage gets cheaper as years go on. Why not bring that cost benefit back to the customer? So it's not the fact that, it costs more to the cloud, and actually it's the complete opposite. So one of the things I remember when Xtium came to me and they presented the solution to me, I knew I had to go to my CEO and present not only the opportunity, but the reasons why we wanted to do this. And we talk about, let's find a competitive edge. Why do we want to move to the cloud? I can be able to deliver those services quicker, faster. I have servers that I can change on a whim to add more resources to make things better. Talk about patient interactions. We talked about earlier before from a standpoint of health information exchange, being able to exchange data. But now we want to know, obviously, with the patient portal and part of meaningful use, your patients at a certain percentage level need to access the patient portal. That patient portal must need to be up all the time, so that interaction is there. And even further, as we continue to grow healthcare, telehealth is becoming a really big boom in technology. And to be able to have my data at any time, and I should be able to see my patient in front of me and be able to generate an encounter, that technology alone will be able to enhance it, because you have full functionality at the cloud level, and be able to add resources and make things better for your patients. So something to think about in regards to the technology. Downtime, minimize. We all know the electronic records now are here. There's no more paper charts. The days of going into a patient room and seeing a chart are gone. If you're down is bad. Down means, I can't see a patient, I can't treat them properly, I now could potentially lose that encounter. We're not generating any sort of revenue. I mean, it all goes away. Cloud-based DR keeps your business afloat. It's always there. So if something were to happen, God forbid, at a facility, you should be able to get to your data, regardless if we're on the West Coast and East Coast, because how we're globally set up from a standpoint from being on the West Coast in Vegas over here on the East Coast in King of Prussia. So it's very important. Minimize downtime. You don't really want to be down at all. Increased productivity. Data is highly available and accessible from anywhere. I stated before that in the cloud, we want to be able to give you the best technology so that you can access it from anytime, anywhere. And then lastly, support for current trends like mobility and BYOD. Go into the cloud, being able to say, I want to bring in my Mac to use. We as Xtium, as a managed service provider, be able to maybe present you an application via the cloud and you have it on your laptop, but technically it's really being ran at the data center. So if something were to happen to that laptop, it got lost, it got stolen, something happened, no patient information will be sitting on that laptop. So you're protected that way. And there's many more technologies like that, but that was one in particular for an example. So next few slides, we're going to talk about, I'm not going to go into really high level as to the step-by-step process on how we go ahead and move people to the cloud, but just a really general overview and understanding. But before we get to that, we're going to do another poll real quick. So in general to this poll, we surveyed 500 IT pros in the U.S. They stated that the budget constraints and time constraints are the biggest challenges effectively managing IT infrastructure. Let's take a look at the question we're going to be presenting here. Okay, if you manage infrastructure on-premise, what is the biggest challenge or concern? Workload of IT staff, security compliance, availability, high total cost of ownership. Maybe we should add all the above. Take a few seconds to answer the question and we'll continue. Okay, what do we got? What do we got to say? And the results are, so if we look at workload of IT staff and time constraints, and we all know this, the folks are on this phone and people that we speak to, we don't have the availability or the ability to hire as many IT people as we want, because in all reality, it's not a possibility. So you really got to do what you do with less, and it's unfortunate because there's not enough time in a day for your IT folks to do the necessary things to keep your local systems afloat. Very good. All right, so just the next slide we're going to talk about the migration process. In very simple overview, high level, taking a look at this process. So we determine the environment scope. So whether it's a health check or a true virtual assessment, we're going to take a look at your entire environment, see how you're configured, see what makes sense. Because if you move to the cloud, we're going to make things better. We're going to have better performance metrics. We know what's the right performance metric for that particular server versus what you may have today. Take a look at what software is compatible. If you're running an older version of Windows 2000 or 2003, God forbid, hopefully you're not, because of a lot of things that are not being supported anymore from a Microsoft standpoint. We'll take a look at that as well. Once we receive all that information, we'll throw back a resource quote or budgeted quote to take a look at. Once those discussions are made, you present your quote to your senior leadership, comes back, and we're ready to go. We then go through a scope and plan the migration. We then build out the environment. We then take that your new set of virtual servers and plan to perform those initial data migrations. We of course test and validate ourselves with you as we work through that progression and migration plan, and then we implement a cutover plan. Depending on the size of your environment, I always say anywhere between 30 to 90 days. It always depends on how big your environment is, and then that can determine how long this process will take. And then another quick overview of disaster recovery process. So a lot of managed service providers out there today who do DR, disaster recovery for companies, they'll set up some sort of virtual connection, virtual private connection, and or dedicated circuit to their DR site, and depending on how much network bandwidth, the speed that gets you to one location to another, that determines how much replication is happening, how quick that happens. But that's it. So it doesn't necessarily talk about any sort of backups that they may be doing, so you're still responsible for that. Where here at Xtium, just a real quick blurb, we do a little of both. So we'll put an appliance out in your site. Not only are you going to replicate your data to this appliance, then we send all that in, and we'll accelerate it to our disaster recovery site. So you have all your servers, all your data at the disaster recovery site as well as on site. Because on site now, for example, if you need to do a restore of a particular file that you may have lost, we now do your backup for you at the same time. So we're killing two birds with one stone. And when we talk to Ampla shortly, this is how they began. They struggled with their backup software, many issues, many sleepless nights. We helped them with that. At the same time, we provided them the disaster recovery that they were looking for as well. So with that, I'm going to hand it over to Verinder and James. Like I stated before, the lack of offsite disaster recovery solution, the issues with backups. So I'll let them jump in and take over, and then we'll go from there. All right, Verinder, James.
Hi everybody. Thanks, Eric, for having us on here. My name is Verinder Suprai. I'm the IT director here at Ampla Health. We're an FQHC that has 12 sites that provide medical, dental, and behavioral health services here in Northern California. We're about headquartered about 40 miles north of Sacramento. So yeah, as Eric was saying, the thing for us was we first implemented our EHR system over 2 years ago. Right away, we realized our original backup system was not going to be able to handle that data, that additional data, and we had to look for a new solution really quick. And we went with our next solution. It did not work out for us the way we had hoped, and at the time we figured that having the data backed up and then those backups just replicated to a different data center, and then if something happened, we can always just pull that data back and rebuild it. But in talking with Eric, because my CFO had got me in touch with Eric when he had worked with the FQHC in Philadelphia at the time, and he kind of told me about Xtium and how they provided almost an on-demand type of disaster recovery. I felt that was the better option, and at that time, our backup system at the time was not meeting our standards. So basically, we got together, and scoped out our plan, and it's been working really well for us. We now have successful replication going, and we're now in the process of trying, about to do our DR tests with Xtium, with the Xtium data center. I mean, one of our big things is, like, I know when Eric showed that poll, what's your biggest concerns? Now, one of ours is natural disasters. We're right in the middle of a flood zone, and being born and raised in this area, I've witnessed 2 floods occur. So we wanted to make sure that the data center we chose did not have the same issues that we have as from the a disaster recovery standpoint. Plus, I had another CIO of another FQHC, and we were discussing disaster recovery, and he brought up a really good point to me. He said, here's your cost for downtime. He basically told me, how many exam rooms do you have? Multiply that by how many, or even how many patients you see an hour. Multiply that by your PPS rate, and that's your hourly loss right there. So it kind of paid that formula right there justified us needing a more robust disaster recovery. And I mean, we basically started within 4 months. We were able to get our disaster recovery site from the time everything got signed to the time we were able to finalize all our replication and whatnot. And it was, you know, and the one thing we do like about Xtium, I mean, if you read our testimonial on their website, is, I mean, everything that we said on there is the truth. I mean, the people, the peace of mind we received from making sure that we know our data is protected, and if something would happen to our on-premise data center, that we are, you know, we are protected. I don't know, James, do you want to give some more detail on this?
Yeah. Hi, I'm James Crandall, Systems Administrator for Ampla Health. Like Brinder said, we tried various backup solutions, disaster recovery. Well, before our EHR, I mean, our disaster recovery was, if the system broke, we used backups to go to a different system. And that created a downtime, which we have a downtime policy. And it's such a dreaded word when we have to tell the sites, well, go ahead and use your downtime policy. So Xtium has helped us replace that word. We instead of use a downtime policy, we spin up an EHR server. We fought with the old systems. We've gone through tape, appliance, cloud. We've tried pretty much the whole gamut. Our previous system was a daily battle to get backups to it. During the process of the transition between our previous system and Xtium, we lost a folder out of our file storage. I talked to my lead IT tech, said, let's try to get this. We argued with our appliance for a few hours, and the backup that we got was corrupted. So I said, okay, well, let's call Eric. We gave Eric a call, and within a couple hours, they had restored that folder for us completely, and they made us look like heroes for the day. So Xtium has really brought a peace of mind to us. The disaster recovery that we never had before, we actually have today. Eric?
Hey, James, I appreciate that. Brinder as well. And it is, you know, sometimes it is good to feel like a hero for a day, because we know when people call us in IT, it's never for a good thing, though. I appreciate that, guys. Really do. So with that, you know, I think we have a few questions that were posted and presented. Maybe I'll have Jen read through the ones that presented, and then I'll answer them for you. And if I don't have a particular answer, and if I need to get back to you, I'll do that as well.
Right, so we do have a question here, but I encourage others on the phone to submit some as well. So if you didn't get a chance to, if you just submit in your question box on the side there, if you could share a question for Eric, we'd be happy to answer anything for you. So go ahead and do that. The first one I do have here for you, Eric, as you're meeting new healthcare clients, what seems to be the biggest reason or major key reason that people move to the cloud, or companies move to the cloud?
Right. So thanks, Jen. So that question itself, I know I talked about it earlier, but you know, two key aspects. We all know whether you have implemented, have not implemented, going through the process, or currently with a software as a service vendor, and you want to move your own data to your own cloud. The EHR movement has been huge. You know, again, being able to have to your electronic health record, again, the charts are gone. There's no more charts anymore. It's all about having that record up. So there's been a lot of concern and questions in regard to, hey, can I just put my EHR in the cloud? So at least I know it's there, it's available, and I can get to it any time. So I'm getting a lot of that. And then the big one, of course, is security. You know, there's a lot more breaches that are happening. We see it all the time now, whether it's through the internet or through, you know, through media, TV, and whatnot. So, you know, the fact that, you know, going to the cloud and Xtium as our example here, you know, data is protected. You know, it's encrypted. I don't know if I mentioned this before, but we know with meaningful use, and part of the meaningful use year-to-year assessment that needs to take place, one of those questions is in regards to your data. is your data being encrypted? Very, very important here, because you may have your data center local in-house today, and I would ask, you know, if you're not in IT already, you know, we may have some CFOs on the phone, you know, ask your IT guys and say, hey, is the data on my storage encrypted? Because that's very, very important. Because as the meaningful use stages go from 3 and up and continue to change, this is going to be a requirement. Very, very important. So at Xtium, that was one of the major key factors as we continue to not only upgrade our infrastructure, upgrade to the newest technology with storage, we make sure that that data at rest, where your PHI sits, is always encrypted. But that's a great question.
Great, Eric. We have one more here. What is the biggest obstacle FQHCs seem to have with gaining buy-in from the leadership team in regards to moving to the cloud?
So a lot of times, this is a great question. You know, I remember my CEO asking me the same question. A lot of times is where, you know, is it going to cost us so much more to go to the cloud when I've already invested all this money in this technology internally? Well, think about it like this. You know, we always look at return on investment, and every few years you're either reprocuring, upgrading, buying new resources like memory and storage, changing the software. Microsoft operating systems need to be updated, so I need to buy. So a lot of those dollars, when I put it in those sort of fashions to my previous CEO, it really hit him to say, you know, this is a lot of money we're going to be spending in the next few years. So you mean to tell me if we move to the cloud, a lot of this goes away? And I said, well, yes, because now, you know, we'll upgrade those operating systems for you. You know, you'll be able to take advantage of those resources, whether it's memory or storage, at the best price that you would get, you know, going out to procure, because you don't really need to anymore. And nowadays, you know, you pick up the phone, I need this, and you get it now versus having to order something and get something, you know, weeks later when in fact you need to do it now. So it's always been about the cost factor, and understanding is it's not more expensive to move to the cloud, because in actuality it's the complete opposite.
And also, Eric, to note, you can also just begin with disaster recovery. We see many customers doing that. Do you want to speak about that?
So yeah, so that's actually how I started with Xtium. I think I mentioned before that I started with DR first because we didn't have DR in our FQHC. And when I joined them, you know, 4 or 5 years ago, and the first thing I walked in, I said, okay, if something were to happen, where's the disaster recovery site? And people looked at me like I had 3 heads. And I went to my managed service provider, who we were with at the time. I said, well, where's our DR? Oh, we don't have that. I couldn't believe what I heard, because at that time we were still paper charts, but as high tech and meaningful use and the Affordable Care Act made those changes happen that we had to be electronic, I needed to be assured that my data was being protected out in the disaster recovery site. So just in case something did happen, whether it's physical building, network, anything that I can still get to that data. So and Jen's right. So the fact is, a lot of people do start from a disaster recovery, DR, backup, and then from there migrate the rest of the environment.
And with disaster recovery, of course, it's important to have multiple data centers throughout the country, just so depending on where you are, you're being backed up to a different geographical area. So as Eric mentioned, Xtium does have a data center out here on the East Coast in Valley Forge, and then we have one out on the West Coast in Las Vegas. But of course, if you're evaluating vendors, it would be important to ask them where their data centers are located.
Great point.
So that's all the questions I received from the audience today. If you have any other questions in the next minute, you can submit them here. If not, I'm just going to move to the next slide. Feel free to submit any at any time to solutions@xtium.com. You can also give us a call. Our number is listed there, and our website as well. So if you have any questions about what was presented today, definitely reach out to us, or if you visit our website, you can also see more about our cloud services and about other additional services, including virtual CIO services, which is another service that I know some FQHCs out there are interested in. And then everyone part of the webinar today is eligible for a free 1-hour virtualization health check. That would be with one of Xtium's certified and trained VMware engineers. So in addition to uncovering any performance, configuration, or security issues, we'll also include recommendations for you to optimize an existing environment, maximize your IT resources, create a roadmap for future improvements, and also mitigate risk by leveraging proven configuration best practices. So we'll be reaching out to you in the next week to get that set up and see if you're interested in that. And if, like I said, in the meantime, if you have any other questions, feel free to contact us. And I think that's all. Thank you, Eric. Thank you, Brinder and James. We're ending a little early here, so we'll give everyone on the line a little bit of time back in your day. And I hope everyone has a good rest of their day.
Thanks again, everyone. Have a great day.